Hi, my name's Catherine Daly, and I'm an occupational therapist. I work in mental health with children, families, and young people. So, our core business as OTs involves working with an individual to ensure that they can have a meaningful participation in essential life activities. It's really helping them to live fulfilling and purposeful and independent lives. Whenever I think about the word occupation, it can be a little tricky to understand, but in the profession of occupational therapy, um, we're looking at what occupies our time, including the things that we want to do, the things that that drive who we are as human beings, the things that we do to create a meaningful life, to adapt and to engage with a wider society and culture. And as OTs, we're really interested in the person, the stories that they bring, the potential that they have, the strengths and the challenges that they may have in creating a meaningful life. So, occupational therapists are the fourth largest allied health profession in Australia. There's about 30,000 of us working across Australia, and we work with people of all ages and across many different areas of need. Broadly, OTs work in aged care, mental health, disability, rehabilitation, pediatrics, just to name a few. And we have a role in health, disability, and community sectors. So we work in private practice, for instance, public health, and non-government organisations. In mental health, which I think is really important, is that we as OTs draw on a broad range of occupational therapy and psychological frameworks and models to help us really provide strengths-based, behaviorally oriented, and goal-directed interventions to improve mental health and well-being of the clients that we see. What really differentiates us from our other mental health colleagues is that unique goal-directed occupational focus of our practice. So we kind of really try to integrate our understanding of mental health and psychological factors, an individual's diagnosis, but really look at how the person may experience mental health and illness and the impact that it has on their ability to function in everyday life. I suppose to make it really kind of practical, my work as a mental health OT is with children, young people, and their families. So I might see a child and a parent due to the parent's mental health and or the child's mental health difficulties, which might be impacting their bond or attachment. And my role with the family is to really listen to their story, to be curious about what might be driving particular behaviors or interactions, and to support an adaptive goodness of fit between the two of them. And I'm really kind of bringing my understanding of development and mental health together in an integrated way to make sense of what's going on for them. So there has been several changes in the last few years in the health landscape, and the changes have been rapid with reform and evolution in aged care, disability, mental health, veterans health, just to name a few. And in the midst of this change, as OTs, we're really focused on meeting clients and families where they're at in their health and well-being journey. So this has meant that we've had to be really quite adaptive and flexible as systems and the landscape around us change. What's really interesting is at OTA, which is the peak body that I work for, we've developed learning resources to support OTs to ensure that they give safe and effective practice. We've been focused on sustaining our professional workforce through kind of resource development to support advocacy around the depth of their scope of practice as OTs. And it's been a challenge to keep up with the pace of change, but it's also been exciting to influence change through the way that we work as OTs, bringing our OT approaches and our practices to the settings that we work in. So working in a multidisciplinary team is essential to our practice as occupational therapists because it does support really good client outcomes, which is what we really want. I feel that the collaborative way that we work as allied health colleagues and medical colleagues is to really help us sort of to listen and to hear the different perspectives from other bodies of knowledge to ensure that we're offering the right fit and contemporary and evidence-based approaches to help our clients. I suppose one of the challenges within, working within a multidisciplinary team can be that struggle sometimes to understand the wide scope and breadth of practice that each may offer. One of the ways that we've been supporting OTs to navigate this is through making sure that we're giving them sort of resources to help them to demonstrate their unique skills, their scope of practice, and to highlight our strong history within our profession as mental health clinicians. I suppose as OTs, our occupational focus and our practical approaches and the integration that we have in putting that within a mental health lens can really offer the multidisciplinary team another port of entry to support good client outcomes. So a few years ago, I read this beautiful statement, and I feel it very much supports the way that I view OT. And it read, "Occupational therapy is where science meets compassion and creativity." And for me, I come with a very strong science lens, but I'm always trying to be curious in the way that I work with children and families. And I'm always trying to integrate that with compassion as I hear their story and work with them to create meaning and purpose in what might be very uncomfortable or challenging seasons in their lives. So in my mind, OT is about science with compassion and creativity.